I can't believe this is affecting me.
Am I?
I'm sorry, crybaby? Crybaby, really? You put that in the intro? Okay, I wasn't crying. I just got water in my eyes. Now, guys, Z-Pac, people have been complaining that we have too many muggles on the show, non-medical folk, Tom and Logan, so we fixed that.
This is a house of learned doctors, people. Actually, I'm just kidding. We're chiropractors.
I was gonna say, you guys look like you escaped from an alternative medicine asylum.
We're going into OR today, Z, with Jeffrey the Giraffe. Jeffrey, we got this? Boom.
Oh, are you,
Nailed it.
Tom?
All right, let's get to today's topic at hand.
Today's topic at hand, many members of the Z-Pac have sent me a news article from NPR and other sources about have we cured sepsis using vitamin C?
So, Z, first of all, I need to ask, what's sepsis?
You are a chiropractor, aren't you? Actually, if you were a chiropractor, you would just adjust the hell out of sepsis. You'd be like, you're cured, snitches. No.
I saw a very confusing commercial the other day on sepsis. Logan, you want to roll that?
Play that.
Every day, 12 children die from sepsis, more than from cancer. Most people don't know the word sepsis or the symptoms. Protect yourself and your loved ones. Know sepsis. To learn more about the symptoms, go to sepsis.org.
Okay, so what the hell is that? Because I have no information.
You mean
now.
you don't know sepsis, Tom?
As a layperson, I have no idea what sepsis is.
So that PSA didn't help you to know sepsis?
Not at all.
It had ominous music. It had a concerned physician.
I know sepsis is bad from that, but I don't know what sepsis is.
It had an ORG website. So let's explain sepsis real quick for muggles and non-muggles. So sepsis is a condition of overwhelming inflammatory immune response in humans that is triggered by infection. And when you get this infection, the body responds through this huge cascade of inflammation that causes horrible things to happen that many times can result in death. Anytime in severe sepsis, 30-40% of the time, depending on the studies that you read. And how does this exactly happen? So you have an infection and it triggers this big response, and what happens is your blood vessels dilate. And you know, Tom, when you're, if you were to turn on every hose in your house at once and every shower and every faucet, how the pressure in your house would drop?
Okay.
That's what happens in sepsis. It's like your body just dilates all the vessels, and now your heart's like, oh crap, where's the pressure? And it starts beating vigorously. That's called tachycardia. So your heart rate can go up, your temperature can go up as a response to the inflammation, or it can actually go down. Your respiratory rate can go up, so you can breathe really fast or slow, and then you can have problems like elevated white blood cell count, which is a sign of inflammation, or a very low white blood cell count, as well as organ failure that can ultimately progress to death. It's a spectrum, Tom. So you can have sepsis and then you can have septic shock. And septic shock is where you have this circulatory collapse. In other words, your heart isn't able to keep up the blood pressure, it isn't able to perfuse the organs, and you are in a serious crisis. And that's when ish goes very wrong.
It reminds me a lot of a Christmas jingle I know.
It's beginning to look a lot like sepsis. Hang the dang Neo. Time is clicking down on the clock when Santa's got septic shock. All he wants for Christmas is some urine flow.
I love that piece for many reasons. Number one, I'm in it. Number two, my Z-Pups are in it. But number three, it hits some important points. Number one, time is ticking down on the clock when Santa's in septic shock. The key to treating sepsis and surviving it is to recognize it early and respond quickly. That means antibiotics, appropriate testing, and fluids to target certain parameters, because you want to make sure there's enough circulating fluid in the blood vessels to perfuse the vital organs. One of the a little bit of crap I got for that particular line, hang the dang Neo, had to do with the fact that neosynephrine is one of these drugs we give to raise blood pressure, but it's like a third line agent in sepsis. So a lot of the critical care folks hit back at me and they're like, well, why didn't you say levo, as in levosynephrine, what do you call it? Leave them dead, right? Levofed. pressor that's first line in sepsis. And I said, it just doesn't sound as good because people will confuse it with levofloxacin. So I chose Neo. So deal with it. But in any case, back to sepsis, right? In sepsis, you recognize it early and then you have to start treating. So treating with antibiotics, treating with fluid, treating with pressors. Those are agents that raise your blood pressure. All these things and more, there's some controversy around giving steroids, et cetera, are our mainstays of treatment for sepsis. Now, for years, we've had difficulty managing sepsis in the ICU setting. You have to ventilate people, you have to support their respiratory system, you have to support their cardiac system, you have to support their kidneys, because a lot of times the kidneys will take a hit in sepsis and you'll end up with kidney failure. So there's a lot of things that can go wrong, and one of the early signs too is mental status changes, so your brain's not getting perfused right. And this inflammatory storm of cytokines and other elements are what caused this generalized collapse. Now, in the setting of this, Tom Heineber, patients die even though we give them support a lot of the time. And there's some theories as to why this is. One of them is that there's a general inflammatory cascade that causes capillaries, very small blood vessels, to start leaking. The cells that kind of keep them together become leaky. Then the capillaries themselves start to microclot, and you end up with problems in circulation. You end up with fluid in the lungs and in other spaces of the body where it shouldn't be, and that triggers sort of a downward spiral that can lead to horrible things, organ failure and death. So the question is, how do we sort of target some therapies towards this? Now, pharma has been trying for years. It's one of the holy grails of pharma to come up with an effective sepsis management agent that they could charge a butt ton for, and that would save lives. Unfortunately, it hasn't happened, and there have been some false starts and some sort of half hopes and things like that, and there are a lot of people studying it. So that's why, that's the context, Tom, right? Do you have any questions?
First of all, I heard that Flintstone vitamins can cure all this.
You are a chiropractor, Tom Heineber. I don't know why I'm bashing chiropractors today. It's because I have this, and I feel like manipulating things.
Let's talk about the study that came out.
Well,
that said,
so I think, knowing that this is the background of sepsis, this study that came out and was reported in the popular press, I have never received, you guys send me stuff all the time and I love it. And a lot of times it's the same thing that multiple people are sending me, and I come up with polite ways to say, yes, I've seen it, thank you. Yes, I've seen it, thank you. It's usually a copy-paste response. In this one, I got literally 100 messages saying, what do you think of this? And it was the headline saying, doctor may have stumbled on cure for sepsis with vitamin C, and here's the actual study in chest. This is not the headline that was actually triggering people. Could we go back? Let's play that again. Yeah, and just pause it there. So, hydrocortisone, vitamin C, and thiamine for the treatment of severe sepsis and septic shock, a retrospective before-after study. Now, that is not a headline that gets Z-Packers to write me and go, oh my gosh, you should talk about this right now, because there's lots of headlines in scientific journals that look like this. This is the headline that got people to can we pause it, Logan? Yeah. That got people to message me. And it was this: doctor stumbles on cure for deadly sepsis, and it's all about vitamin C. It sounds like something ripped out of the Dr. Oz show, doesn't it? And this is typical of the press, especially when dealing with scientific topics. It's complex, it's nuanced, it's preliminary. Let's put a clickbait headline on there, which we're really good at, Tom Heineber, and let's get people to go, oh my God, they've cured sepsis. And you know what? Those of us on the front lines aren't immune to this, because we see sepsis kill people every day. If you work in the ICU, if you work in the ER, if you work in the hospital, if you work with kids and adults, you're gonna see this. We get excited. We go, could we have missed something that's as simple as a vitamin infusion that could save lives? And it triggers all the alternative medicine quacks to go, we told you so, it's all about vitamins, bro. And it triggers, the popular press to go crazy. But we, as caregivers, as practitioners of the sacred art of medicine, it's obligatory for us to actually unpack what's actually going on, to look at the primary study and to realize what it means and what it doesn't mean. Okay. In fact, let's look.
So unpacking it.
Yeah.
What do you think it meant to you? You read the original study title.
Well, yeah. So when I read the first title, my first thought was, oh, great. It's going to be total BS, because we hear this stuff all the time. Then I read through the article, and it was about a Dr. Marik at Eastern Virginia Medical School. He's a critical care doc, fairly respected. And he had basically looked at other people's research, including this guy Alpha Berry Brown or something.
That's a dope name.
Yeah.
That sounds like a character in Guardians of the Galaxy.
Yep. Or like
We got to go across the galaxy to see Alpha Berry Brown.
or
He knows how to cure sepsis.
Smurfette's evil twin Alpha Berry. And so, already like you're handicapped because you have a name like Alpha Berry Brown and you're a doc and you're trying to study vitamins. It's like, oh, good luck. Good luck getting NIH funding for that. So what ended up happening was he looked at this data and he said, oh, there's some stuff with vitamin C that's been going on for years. In fact, dating back to 2009, they'd been talking in the literature when I did my lit search for this about vitamin C and its effect on endothelial cells, inflammation, and the immune response in severe conditions like sepsis. Now, they'd never really pushed further than that. And this doc realized, okay, I've got this lady who's in her 40s or 50s, I forget how old she was, and she was dying of sepsis. She had severe sepsis, organ failure. He expected her to die by the morning. He said, you know what, we got nothing to lose. How about this? We'll give some hydrocortisone, IV steroid, which is in sepsis is considered, there's some anti-inflammatory, anti-immune properties, and it's been studied in sepsis and it's never really panned out. Maybe some people will recommend it for severe sepsis, but it's kind of on the fence. Steroids by themselves, okay? The second thing is, he said, I'm gonna give some thiamine, which is a typical vitamin we often give IV, especially to alcoholics, because they can't drink and they're often vitamin deficient. And so he said, let's throw some thiamine in there. And then he said, vitamin C, high dose, IV. And let's give it together every 6 hours. And I forget, you'll have to read the exact paper, which I did today, where he actually lays out what the protocol was. But it's often, it's like every 6 hours. So hydrocortisone 50, vitamin C, I forget how much he's giving, and the thiamine. And what he found is the next morning she was getting better. And then she ultimately was discharged. And he said, wait a minute. So then he started doing it more and more. And he's like, dude, I'm actually anecdotally seeing stuff happen, and it has some scientific merit because the anti-inflammatory properties of the steroid, there's some theory that it synergizes, it works together with the vitamin C to allow it to enter the cells and do what it does to the endothelium and prevent that cascade of microclotting and inflammation that I was saying kills people in sepsis. So in the setting of all this, he said, okay, how about this? Let's continue to do this for our patients because these drugs are relatively safe, although we're going to unpack that in a second. Don't let me forget, Tom. I want to talk about the risk of vitamin C and steroids. And let's give it to patients. And then what we'll do is we'll do a retrospective before and after study using EPIC, the EHR, where they mine the data from EPIC, and they compare a group of 47 patients in the critical care ICU in the 7 months before, or for 7 months prior to when they started treating patients with vitamin C. And then they look at patients after that. For 7 months, they were getting this vitamin C protocol, and they compared the two groups. 47 patients, they matched them based on severity of disease. They said, okay, these are very similar patients. And they said, what happens? And this is what they found. They found that in the group they treated with vitamin C, only 4 people died out of 47. And some of those died purely on the result of their underlying disease that triggered the sepsis, like dementia, cancer, Alzheimer's, etc., not the sepsis itself. Whereas in the other group, the 7 months prior that didn't get the vitamin C, roughly 19 patients died, which is more in line with standard sepsis. And so he said, well, here you go. And the trial was published as a preliminary in Chest, the journal Chest, which the only way I was able to get the article itself, Tom, is because I was like, man, this thing's behind a paywall. I can't get the raw article. And so I told my wife about it, and she's like, oh, I got access to Chest because I'm a real doctor. and
I'm not just a rapping doctor.
Exactly. And she's still on staff at Stanford, and she's a chest radiologist. So she pulled me the article, and I read it prior to the show.
So this is incredibly complex, okay? I don't understand any of it, but I do understand vitamin C cures sepsis. You know what I'm saying?
And so as a muggle, Tom, you're actually expressing what a lot of people who read this article in NPR or other places are going to say, especially the headline I just read you from Tech Times. Cure for sepsis found, and it's vitamin C. Okay, that's crazy talk. Let's unpack why. This is a small study, number one. That's a problem. Whenever you have a tiny trial, it can lead you to bigger trials. It can point you in a direction that you may have found something right, but it is never going to give you a definitive answer because you don't have enough power to see, is it due to chance? The second problem with this trial is that it was a retrospective before and after trial. What does that mean? What that means is that they looked back in time at a set of group of patients who didn't get the intervention and then a set of patients who did, and they were sequential. Two problems with that. It's not moving forward. In other words, you're not saying, I'm going to do a test and I have a hypothesis and I'm going to have a plan where I do a double-blind, placebo-controlled trial where nobody knows what treatment they're getting and we're moving forward and they're randomly assigned to groups. No, this was not random, nor was it blinded. And on top of that, they were sequential, which means the first group had a different environment than the second group. The group that didn't get the treatment may have been it was in a different season of the year. And the group that came after was in a different season of the year. That group that came after, who knows what could have happened in that hospital in the intervening time. So it's not a perfect trial. And on top of that, it was a single hospital. Could it be that everyone in that population was vitamin C deficient? So by giving them vitamin C, you've given them a leg up. So these are the subtleties that you have to tease out when you're designing trials and also reviewing trials, which means you can't just read the press. You have to go and look at the trial, which means we need the tools and the capacity to do that. This is why anti-vaxxers, Tom, they fail. They look at small trials, they read the headline, they don't look at the raw data, they don't have the tools to process it, and they look at us as being biased, even though we do have the tools to look at those small trials and go, no, this trial is bullshit. And that's part of the problem. Now, the other problem with this particular trial, unpacking this trial, is that the treatment group and the non-treatment group, 60% of the non-treatment group that wasn't getting vitamin C got steroids in the form of hydrocortisone. So 40% didn't. In the treatment group, everybody got hydrocortisone. So could it just be a hydrocortisone effect that's causing the saved lives in this particular instance and population? Instead, they gave nothing or a mix like a little hydrocortisone or not versus 3 medications, thiamine, vitamin C, and the steroids. So you're going to need more studies to show, was it the vitamin C, was it the vitamin C and the steroids, or was it all 3? Or was it just a fluke of statistics? That's how you unpack trials, and there's more you can do. But the idea that the press would say the cure has been found for vitamin C is dangerous, misleading, and it devalues the fact that we as scientists have to do better to unpack these things.
And this is just the media's fault. The doctor who studied the trial didn't mislead anyone on purpose.
He sounds to me like a heroic doc who saw an anecdotal thing and challenged it and went through and did it. And he even says in the article, he says, look, this isn't about money, it isn't about this. It means we need more studies. It's hard to do these big randomized control studies. I think it's unethical not to try stuff. So I'm trying stuff and it's safe and it's effective and he kept doing it. So he treated another 150 patients after the trial and had 1 death. And so it makes you go, okay, is there something going on? I'll tell you what my instinct tells me, Z-Pack. My instinct is to be skeptical of small trials and to always question it, but my gut is telling me he's on to something, he's found something, because these numbers are really quite dramatic, so we need to study it. Now, the question is, Tom, would you ethically be able to just start giving patients vitamin C, thiamine, and steroids in a septic situation, or do you have to wait for a randomized controlled trial to be the gold standard before you do it?
To me, as a layman, I would think ethically, since someone's life is on the line, you have to wait until it's proven effective. I mean, maybe I'm wrong.
Yeah. Well, what was it? Never match wits with a Sicilian when death is on the line. That has nothing to do with what you just said, but I just wanted to do a Princess Bride quote. So that is one stance that I think it can be valid. Where I might push back on this is, no, this is actually pretty safe. So if there's anecdotal evidence, let's try it if it's not going to cause harm. Now the question is, can this therapy cause harm? Here's the key thing. We're not talking about oral vitamin C. So let's clear that up right now. There is a difference in how these things are absorbed and how they have effect on endothelial lining in theory. IV vitamin C is crystalline ascorbic acid dissolved in water and a base and injected. So it's given very differently. That's how they're giving it. Now, you guys who are in the know, especially pharmacists, understand that vitamin C at high doses in patients with kidney dysfunction can cause precipitation of ascorbic acid crystals in the kidney. Let me unpack that really quick. That means that the kidney's filtering blood, you have this high concentration of this acid. It can come out like salt comes out of cold water, right, at the bottom in your kidneys and cause serious kidney damage. This was a concern. In this trial, they didn't see that happen, and a good percentage of their patients actually had pre-existing kidney injury from the sepsis itself. So this is actually a concern. Do you want to give high dose ascorbic acid to patients who you might cause harm? That's where you have to weigh it. Now these are patients who have a good likelihood of dying in any event. So should we throw the book at them like end-stage cancer patients where we try crazy dangerous therapies, right? Called chemotherapy.
Well,
right?
if the patient might want it.
Right. Now,
Correct.
the thing is, these aren't patients able to make, they don't have agency. They're unconscious, intubated on a ventilator. Their families are making these decisions. So part of the reason we're having this discussion is so family members can ask educated questions about this, because if they come with an article that it says vitamin C cures sepsis, and it's the wrong fit for their dad or their mom or their loved one or their kid, the doctor's got to sit and parse with them. And a lot of times that's where we don't have the time in Health 2.0 to do that. So it all gets back to we have to be able to communicate, especially science. Do you think we should take some comments before we go
Yeah,
on?
totally.
Yeah.
Matt Phillips had a great one. The history of medicine is littered with great ideas that bumped people off.
Absolutely. Estrogen, postmenopausal, turns out maybe not a good thing, but even early randomized trials said it might be. So science is plastic because it's hard and there's a lot of variables that you have to compensate for. Now, as we get artificial intelligence and stuff, we'll probably do our science smarter, but still, we have a long way to go.
Orville Carabala says they just need an adjustment from a chiropractor and maybe some essential oils. I got you, bro. Let's do this adjustment. Come to my office Tuesday.
It's that cannabis hat that I think really gives you legitimacy, especially in California, Colorado, and now Nevada.
It's legal, bro.
It's legal, bro. Just like Diet Coke. Coke Zero. Sorry, I don't want to harsh your Coke mellow. There was I posted the article a little earlier. There was a really funny piece, and it actually somebody had made this comment about the Marik, the doctor who did the original study, said, this is very anti-capitalistic. Like, there aren't pharma companies that make vitamin C. This is the cost of a single dose of antibiotics, and so nobody wants to study it because there's no profit motive in it. And who was it who wrote the comment? It was really funny. They said, oh, he says that there's no profit motive, and every pharma company around the country right now is like, hold my beer. We will figure out a way to
I'm
find
going in, bro.
We're
we
going to
can weaponize vitamin C, bro.
Exactly.
We can do it.
You see, Z-Dog, you don't understand. When you put the vitamin C in a microsomic combination with a triple drug, vitamin C, thiamine, and hydrocort, we call it Vitabacort, we can patent that, and we can charge $70 million per dose because the number of quality of life years saved, right? So you can see where this is going to go. The other thing, though, that brings up a point. Why hasn't this been studied? Now, the anti-vax clowns and other alternative medicine people will say, well, when there isn't profit motive, it doesn't get studied. And this is where I'll actually say that may be true. And that's why you need sort of docs like this on the front lines taking some challenges and saying, I'm going to try this, and then we're going to do a larger trial. Because this is the kind of thing where publicly funded science can be a big thing, because you're not going to get a private company to fund it, so you're going to end up doing it through the public.
Yeah, isn't that the way the system is set up right now, to go through the university system for the fringe science or things that may not necessarily have profit at this time?
It's not quite as simple as that, but it is. Let's just say there aren't going to be the conflicts of interest when Pfizer funds a trial on, Viagra. That the trial is going to be designed a certain way. It's going to be designed and powered to show that it's better than whatever the competitor is. It's not going to be the most noble science, although it may still be valid, right? So I'm not going to discount it, but I'm going to say, in this case, if you have a NIH-funded trial and there aren't conflicts, and the doctors also, because there's internal conflicts because it's a publish or perish thing. And I'm not saying this doctor is doing that. I'm saying it's in the interest of an academic career to publish a lot and be respected in your field.
Well, is there a thing about this? This seems like it got out too early before it could be vetted by the medical community.
Well, yeah, it was a prelim draft in chest, and I think it generated a lot of excitement, and the press got a hold of it. But the truth is, it is exciting, Tom. The numbers that he showed were really exciting. The thing is, like that commenter said, history is littered with examples of this that have gone wrong. Remember cold fusion?
Oh, yeah.
Yeah. Oh my God, we've cured the energy crisis for the foreseeable future because these guys have been able to create unlimited amounts of electricity from deuterium in a cold scenario, and yay, it's going to be like Mr. Fusion, and where we're going, Marty, we don't need roads. And instead, we're still burning frickin' coal, right? So, which... Science!
Well, we're trying to get to fission, right, with nuclear capabilities.
But by the way, I just love how Logan was just sitting there and he looks at me with his puppy dog eyes and he's like, science? And that's his way of saying, can I turn on the reverb for you, Z-Dog? Because I really want to do the reverb thing. That was adorable. Sorry, so you're saying fission.
Here's the thing. Okay, like, even people like Steve Jobs, you know, who were very smart guys, thought that they could cure their cancer with an all-organic diet.
Right.
So people are going to take this vitamin C thing.
Yeah, they are.
For the win. And then they're going to extrapolate, Z. You know they're going to extrapolate. They're going to say, not only can it cure sepsis, probably AIDS, too.
You know what? I already see it happening because in some of the comments I'm seeing people like, see, it's natural. And you know, all I know, okay, is everything I learned about vitamin C, and I'm going to, actually, this is an interesting point because doctors don't learn nutrition. We don't learn it in medical school very well. We learn about the vitamins in terms of their deficiencies, not in terms of their, and it's some in terms of their megadoses, but not in terms of other research and stuff. Everything I learned about vitamin C, I learned from Gilligan's Island. Because there was that episode where Gilligan, where the whole crew started having like teeth falling out. Like I think the skipper had a tooth fall out and their skin was wrong.
Well, he was an alcoholic. But
the skipper was not only was an alcoholic, he was like one of those guys that if he didn't drink in the morning his fermented coconut juice, he was going to withdraw like right then. Like he was going to have like Gilligan's Island DTs, you know what I'm saying? And they started having all these symptoms. And the professor, who by the way is not a doctor, okay, he's some kind of professor.
Yeah, he was just a lecturer.
He was like science, like Bill Nye, except not a very good communicator.
It seemed to be his entire thing. Was he a professor of coconuts? Because he knew a lot about coconuts.
He could build like a coconut-based economy from nothing, and science and cars that rode on coconut oil. But he had said, look, guys, this is a scurvy issue. Like you guys are deficient in vitamin C, and you know, we got to find some oranges. And it turns out in the end, Gilligan knew where there was a lemon tree. They were all trying to ration this one orange. Gilligan knew where the lemon tree was. It was on the other side of the island, but he never said anything because he didn't realize lemons had vitamin C. And from that moment, I knew everything I needed to know about vitamin C.
The thing I know about Gilligan's Island is that if you get a TBI from a coconut, all it takes is another coconut to fix it.
Back in those days, yeah, if you got amnesia from a traumatic brain injury, you just get another one. Just like, bonk, oh, my memory's back. You just jarred it back. No, what you have now is dementia pugilistica. Like you have permanently damaged your future.
Craig Wax says, yes, IV vitamin therapy is a cure for not only sepsis, but cancer. You serious, Craig?
Craig is not serious because I know Craig. Craig has got like a smirk on his face. Like he's like this. He's got actually, knowing Craig, he's got a bilateral Bell's palsy. He's just like this. Because that's his style. I made that up. I have no idea who Craig is. No, I do know who Craig is, but I think he's joking. But it's true, like a lot of people will take this. I mean, what about adrenal function with the steroids, autumn-lytic? So in sepsis, a lot of times adrenal function is wacky and suppressed in any event. So giving the steroids in sepsis as a stress steroid, and it's often hydrocortisone, which is a more physiologic steroid, at least in theory. We often give that, 100 Q, BID or TID to start, and then we can wean it to 100 a day, depending. So this is a common protocol. So the fact that we use steroids in sepsis isn't unusual. I think what's unusual is this combination of the three. What are some other good comments?
Let's see.
These patients are like any port in a storm. They're going to die and die trying. Diego Wee. That's a little harsh, Diego. Just sit right back and you'll hear a tale of a fateful trip.
Linda King says, ADD, stay on subject. So you don't want to hear 3 more hours of Gilligan's Island humor, or no? Or
that
what's
started
up,
on this tropic isle aboard this septic ship. The patient was trying to crump, his kidneys, they were boxed. If not for the courage of the fearless crew, we'd have to transfer him to another doc. All right, back to the lecture at hand. Red Lobster biscuit injections, at least it'd be delicious. Deborah Browning, thank you, Deborah. Other stuff on this sepsis idea. So I think the takeaway from this is, I think it's fine to anecdotally try this to kind of follow his protocol and see what happens, but I think we need a randomized control trial. I think stuff is going on with vitamin C currently, but not with vitamin C, steroids, and thiamine in the cocktail that this guy invented. And by the way, I want to give my hats off to Dr. Marik. If he ever wants to be on the show and talk about his study, I would be honored to have him because he's a true hero in that he's pushing forward the science and he's doing it in a pretty humble way. So whatever the press does with his headlines, he's trying really hard to save lives, and he may be succeeding, in which case he's going to be one of the great heroes, right? Because sepsis is this big pinnacle to overcome. What you got there, Tom Heineber?
Let's see. Vitamin C is the new Windex. It cures everything. I think you mean WD-40, Neil Desai.
Put a little Windex on it. Z-Dog question, if you were caring for a sepsis patient circling the drain, would you be willing to give it a try? Dean Spearbrecker. Yes, I would, Dean. In fact, knowing what I've read and learned from this, which is why we keep reading and learning and talking to our colleagues and going to grand rounds and watching my show, is now I have something in my armamentarium. It's someone who's doing poorly, we can give it. And again, it's pretty low risk. Now the kidney thing is real, but if you're dying of sepsis and your kidneys are boxed anyways, it's kind of like, well, you know, just man the torpedoes and go and hope. And this guy's seen some pretty tremendous results. It's really quite remarkable for a small trial. But again, it's a small trial, and we're littered with small trials that show bad things. And there's bad small trials, like Andrew Wakefield's, which was falsified, showing MMR caused autism. Totally falsified, right?
Seems hard to me if I was a doc and I had read this study and I had a confirmation bias that this might be correct, and I had a patient dying of sepsis. I might want to use it right then and there, right?
Yeah. I mean, I think you would, especially if you have that, you know, what Tom called a confirmation bias. Like you already believe this, and any information you see is just you're gonna take what confirms your elephant's suspicion, your unconscious elephant's bias, and you're gonna reject or argue with information that contradicts it. And this is common with the anti-vaxxers and the pro-vaxxers. They'll, you know, but the problem is there's no good evidence that vaccines cause autism. So there's really no confirmation bias, just on the side of the anti-vaxxers.
Kyla Ray says, how about a prevention of sepsis rather than a cure for it?
How about a prevention of sepsis rather than a cure for it? Okay, so the trick with preventing sepsis is a lot of times, in a good percentage of cases, we never even know what the provoking infection was. So we've treated it never grows in culture, it's culture negative sepsis. So how do you prevent something when you don't even know what it is? Next, how do you prevent infection? Well, in the hospital, we have a lot of great techniques. In the real world, sometimes people are at risk. If you're immunocompromised, if you've had your spleen out, if you're on chemotherapy, you're at risk. You can lower risk by washing hands, by staying safe, all the other things you do. But you're never going to 100% prevent sepsis, but we can do better. Now, I think more actionable in the short run is, can we recognize sepsis and treat it rapidly and save lives? And that was part of the reason why we made It's Beginning to Look a Lot Like Sepsis, because people were kind of, the song gets caught in your head and then you're just thinking about sepsis. And you see a patient and you go, you know what, that could be early sepsis. Let's act quickly. And that's when you draw the lactate, you give the fluid, you get them to the ICU, and you do all the things that you're supposed to do for sepsis in the bundle or whatever your particular institution is pushing at that time. How many of you guys want to see an expert in sepsis on the show, like my brother-in-law, ID Dog, or somebody like that? Let us know, because we'll fly him out. Like, that's worth spending the money on a ticket to get Jamie out here and have him talk about this, because I think it's such an important topic.
And we are going to start taking more guests on the show. We just are waiting to move out of Z's house.
Yeah.
Because, you know.
It's kind of hard to bring guests into my home. Like, I feel bad, my wife and kids, and we're bringing... it's just uncomfortable, because sometimes we're going to disagree with the guests. Sometimes we're going to have people on just to have confrontations, and I don't really want them in my house. So we're going with a real estate agent this week to try to find some more pro studio space. And Tom needs an industrial grade toilet, because he's a big guy.
It happens.
He farted right now.
That is untrue.
He did.
Logan is still thinking, when can we do that science thing again? Because it's science. Let me read some more comments, because
let's see. Patricia Stoop says, "Why is Tom a doctor? Did he go to the Natural Health University in Samoa?" Listen, Patricia, I didn't watch all 12 seasons of Grey's Anatomy for you to call me out on this show, girl. Back to you, Z.
I'm going to start calling camera 2 our Muggle Cam. It's just, go to the Muggle Cam, Logan.
The thing is, Z, I heard vitamin C cures sepsis.
And of course, you know, the actual doctor, the Stanford-trained, 10 years hospitalist, UCSF, smarty pants. Hey guys, look, I can pick my nose with a, good. Let me just, It's what we do, people.
Robert says the professor could build a nuclear reactor from a coconut, but couldn't fix a hole in the boat.
It's true. It's true. He's like, check it out, guys. We have 3 unlicensed coconut reactors on our back, and we're ready to fight ghosts. Okay, how about this, Professor? The boat that gets us back to the mainland, could we have that, please? Because that would be dope. Anyways, I think, Tom...
Yeah, let's stay on topic today. Do you have anything else to say about sepsis?
I think we've talked quite a bit about it. I'm going to go through the comments later. I think this was a great discussion. What I want you guys to do, your homework is to read the primary article when it's available in Chest and give me feedback on where you think the weaknesses are. I mean, I think that, again, the main weakness is single center, so anything could be going on at that center. All the patients could be vitamin deficient. Sequential retrospective trial, which is sub-ideal. We need a prospective randomized control trial to look at it. And the idea that hydrocortisone spanned both groups. I want to see, treatment versus control. Like either give both groups hydrocortisone or only give one group hydrocortisone, but don't have it kind of mixed like that. So those are my, off the top of my head, reading the trial for the first time today, thoughts. Guys, it's always real. Here's what I want you to do though. We are now number 13 on iTunes top science and medicine podcasts. We are in such esteemed company as the Paranormal Report, okay? We can beat them if you go to iTunes, and the link is in the description of this video, and rate and review our podcast, subscribe and listen to it. Tom edits it at night, makes it nice and clean, and so you can listen to it on your commute, you can share it with your friends.
I got you. Also, Tech Time's your fake news. You know it.
On that note, Z-Pack, we are so out right now. Peace.
Go.
I can't believe this is affecting me.
I'm alright. Uh-huh.